Okay, in this video, I'm just going to talk about some very basic directional terms that are used. I'm going to talk about movements, planes of movements, and axes, and some of the movements that we talk about when we're just trying to describe movements of the body. So first of all, some directions. So when we're talking about regions of the body, we'll talk about up and down is superior and inferior. People also use the term cranial towards the head and caudal towards the tail. Front and back is anterior and posterior. And then side to side is medial, medial coming towards the midline, inframedial, and then lateral is moving away from the midline. Now when we're trying to describe human movement, we usually describe it in terms of planes. So planes is the idea of, you can think about dividing your body in different ways. So if you were to cut yourself in two halves coming down, it's kind of cutting yourself through the ears and making a front and a back, an anterior and posterior, that's the frontal plane. So when I'm waving my arms like this, I'm in the frontal plane. Okay, you can think about cheese between pieces of bread. Okay, that's the frontal plane. Another way you could cut your body is down the middle through your nose. Okay, and this would be that particular viewpoint. That would be a sagittal cut, and so that's the sagittal plane. So when I move like this, I'm moving in the sagittal plane. So you're kind of two halves, medial and lateral. The third plane we talk about is the transverse plane. People also call it the horizontal plane, which is fine. And that's a cut right through your navel. So you have a top and a bottom. So a superior and an inferior half. Okay, and this would be movement in the transverse plane. So those are the three planes of movement. And when we talk about the different movements, they always fit into one of those planes. Now, in addition to the planes of movement, you need to understand that movement occurs around an axis. So when we talk about frontal plane movement, which would be this, okay, an axis always goes 90 degrees. So if you can imagine, particularly my shoulder, that axis coming in this way, okay, that axis is running what we call anterior posterior. So remember I said if you cut yourself in half, there's an anterior and posterior halves. You can think of that for the axis as well. The axis goes anterior and posterior. So when I'm moving my arm in the frontal plane, that axis goes anterior, posterior. For the sagittal plane, remember that's this movement, okay? That axis is going to come right through here, okay? So it's going to run what we say medial lateral, okay? So remember sagittal plane movement is this, and that axis that has to come at 90 degrees is going to come right through here, okay? And we say that it runs medial lateral. And then for the transverse plane, where you're cut in half this way, and I'm moving this way, that axis is going to come right from above. Okay, a good analogy, if you think of the Earth spinning on its axis, right? That's kind of a rotary movement like this, and the axis goes from the poles, same idea. Okay, so again, this is movement in the frontal plane, or I'm sorry, in the transverse plane, and the axis is going to come from the top, superior to inferior. Okay, so now I'm going to talk about the movements that we typically put in each of those planes. And there's really just three different types of movements that we talk about. And another thing to keep in mind is that each plane can also be, when we talk about movements, we also talk about degrees of freedom, and that corresponds with the planes, and I'll get back to that. So this movement in the frontal plane is known as ab and adduction. Abduction, ABD, is moving away from the midline. Adduction, ADD, is moving towards the midline. In the sagittal plane, okay, moving this way, flexion is moving superior in that sagittal plane, and extension is moving inferior in that plane. And then for the transverse plane, that's going to be rotation, so it look like this or look like this. And for rotation, when we talk about, especially like the extremities, we talk about what we call medial rotation, moving towards the midline, or lateral rotation, moving away from the midline. People will also use the terms internal rotation and external rotation, which is fine. Now the one caveat, there's two things to keep in mind. One is that these movements with the planes are true about 95% of the time. There are a couple of joints in the body that are orientated a little bit differently, and therefore there's different movements in different planes. It only occurs in a couple of places. When we get to those points, we'll talk about them, but there are a few places where that happens. Regardless of what plane a movement occurs, the axis always stays the same. Okay, so for example, whatever movement happens in the frontal plane, the axis is always anterior, posterior. Whatever movement happens in the sagittal plane, that axis is always medial lateral. And whatever movement happens in the transverse plane, that axis always runs superior inferior, even if the movements wind up being a little bit different, and that's always because the joint maybe is oriented a little bit differently. The other thing to remember is that this all really refers to what we call the appendicular skeleton, meaning the extremities. So the upper extremities and the lower extremities. When we talk about movement of the spine, it's a little bit different. Okay, you still have movements in those planes, but because we've basically described these movements in terms of where they are in relation to the midline, when you talk about spinal movement, you're coming from the midline. So we have to use a little bit different terminology. Okay, we do talk about flexion and extension. That doesn't really change. But we'll also talk about what we call lateral flexion, okay, which is movement in the frontal plane. Okay? And then we also, when we talk about rotation in the spine, we can't talk about medial or lateral rotation because we're coming from the middle. So in that case, we talk about right and left rotation. But that's a term that we only use for spinal movements, either the neck or the lower spine. And then just getting back to the degrees of freedom, we talk about joints can have, most joints are going to have flexion, extension, ab and adduction, or rotation. They may have all of those, they may have one of those. There's a few other movements that are particular to particular joints. We talk about how many degrees of freedom they have, and that always relates to movements in one plane. So for example, if a joint has just flexion and extension, we say it has 1 degree of freedom. Even though flexion and extension are 2 different movements, they're in the same plane, and there's no such thing as a joint that allows flexion but not extension. Okay, the most degrees of freedom any joint can have is 3, because there's only 3 planes of movement. There are a few joints, again, we talk about extra movements, but those are usually a combination of different planes and not anything special. So that's just a general review of movements of the body.